Hi, I'm Dr. Rohit Arora. I'm a pediatrician and neonatologist at Cloudnine Hospital, Golf Course Road, Gurugram. Ear infection in infants can be a very distressing condition for the parents. Reason being, ear infection is an extremely painful condition for the newborns and the infants. So kids are crying unconsolably when they have ear infection, and no matter what parents do, sometimes they just don't stop crying. So it can be very distressing for the parents. And other symptoms of knowing that it's probably ear infection is that they are always ear pulling all the time. They're not feeding well, and when they don't feed, or even for that matter they don't drink milk or water, so their pee count goes less. So all these are pointers towards that there is an underlying ear infection. We always tell the parents that whenever there is an unconsolable cry, it's likely that it's an underlying ear infection or a dental infection. These two are the reasons of one of the important reasons of unconsolable cry in infants. Now, how it happens? It can happen just when kids are fed when they are lying down. When they, especially the bottle feeding, if they are on formula and drink bottled milk, then milk can travel into the ear easily through the horizontal eustachian tube, which is horizontal in the kids. So that's how they generally catch ear infection. So they are always ear pulling, they are crying, they are all over the place, tossing and turning on the bed. So, and they can run very high fever also at the time. So such babies should always be taken to the pediatrician, and treatment wise, generally fever management, pain management is required. Antibiotics are generally given for a particular period of time. Then you can find certain ear discharge when you look inside the ear that there is some pus coming out. So accordingly you have to manage. Generally the dictum is to keep the ear dry, not to put ear drops, and try to give antibiotics and then re-examine after 5 to 7 days to see whether healing has happened or not. Sometimes when there is overwhelming infection and ENT input is required, and even it can go into surgical management as well. So ear infections are quite common in infants. Lying down position should be avoided when you are feeding the babies, and the certain vaccinations, especially the pneumococcal vaccine, it really brings down the chances of ear infection by a lot. So please make sure that you get your child to get this pneumococcal vaccine. It's not just for pneumonia, it's also very good for prevention of ear infections. Thank you very much.